Greetings, YouTubers. Liberals have been caterwauling like little girls since Bill Clinton and a Democrat Congress failed miserably to make everyone wards of the state in some kind of bastardized Medicare for All program. Obama has picked up this torch and is determined to spend us into healthcare nirvana. But is this a wise move? Leftists often use generalized nonsense such as healthcare for all, often forgetting that healthcare coverage doesn't mean actual delivery of healthcare services. Without looking at the details, we'll explode the following common myths and more. Myth number 1. The uninsured are driving up healthcare costs and crowding ERs. That's false. It's mostly those on government-funded programs like Medicaid and Medicare who are doing this. Myth number 2. There are 48 million Americans without health care. This is false and depends on how you define American. Many of these 48 million uninsured are illegal aliens, are under 24 and perfectly healthy, qualify but fail to enroll in SHIP or Medicaid, or live in a household making over $75,000 a year. After eliminating those people, we have less than 5% of the population who is genuinely uninsured and doesn't qualify for some social program. Myth number 3. Canada's single-payer system is a success. This is false, and over the past decade, Canada has massively increased funding for healthcare, yet waiting times continue to increase. In fact, they're seeing rationing there. If you need a hip replacement and you're not employed, if you're over 70, retired, and you need a hip replacement, forget about it. Myth number 4. The UK's National Health Service is a success. It isn't. In fact, you're far more likely to get a transplant and survive it for 1 year here in the US than you are in the UK. The UK even lags behind most of Europe in this category. You're far more likely to have a 5-year cancer survival rate in the US than in the UK. Myth number 5. Evil insurance companies are the reason healthcare costs are going up. That is also false. What has gone up is the number of mandates coupled with the inability to purchase insurance across state lines. That insurers was gone up the number of mandates that insurers are required to cover, such as mental health parity, drug and marriage counseling, chiropractor, hair pieces, in vitro fertilization, etc. All these mandates drive up costs. Less and less of the healthcare expenditures are out of pocket and more are government funded. In contrast, laser eye surgery, because it is typically not mandated, has seen its costs fall over the past several years because of competition. Hawaii tried their hand at universal health care for children and had to dump it after 7 months because people said, oh, well, I got private insurance. Well, why pay for that when I can dump it and get the government to pay for it, i.e. the taxpayer? Massachusetts mandated healthcare reform is more than $400 million over budget. Thank you, Mitt Romney. So as you can see, and there's other states that have dabbled in this, and some had dumped it before they implemented it because they realized it was going to put such a massive hole in the state budget they'd never be able to pay for it. Those myths and many more are debunked in the essay. That, of course, is linked to the right side of your screen. That will require some reading, leftists, and not just the generalized, oh, you're stupid. Oh, healthcare is a success in Canada. When you look at the details, it's not a success there. So this requires a little reading, a little work, and less cut and paste talking points.